Hello everyone, welcome back to my YouTube channel. I am Diksha Pandey, final year medical student in Tbilisi, Georgia, and today we have with us very special guest Dr. Sandeep Sharma. He did his MD Pediatrics from PGI Chandigarh and currently he is in doc tutorials as well as RISE faculty. Welcome sir to this conversation. I still remember that last year we have online session and now I got the opportunity to do it offline and I am very blessed and grateful for the opportunity. Welcome to this session.
Thank you Diksha. Hi everyone, I am Dr. Sandeep Sharma. Exactly almost a year back, myself and Diksha had interacted on the Instagram and now I am in Georgia right now and I am discussing. So Diksha asked me to just connect with her and for the benefit of all the FMGE and NEET PG aspirants. And she has a few queries, right?
Yep.
So let's see what she is going to shoot at me and I'll try to give a honest, unbiased opinion on that.
Yeah. So my first question is that always when I solve question, I take all the 4 MCQs and I always get stuck in 2 MCQs and always I mark the wrong one. So how I use the elimination method to get to the correct answer?
See, this is a perennial problem with, I think ever since MCQ world has started and MCQs have started, being used in competitive exam, it is a chronic problem that people will be able to rule out one option, maybe rule out 2 options, but they will get stuck up in the remaining 2. And often it will happen is that you will end up marking the wrong answer and many times initially you will mark the correct answer and then you will change it to the wrong answer. There are 2 or 3 aspects to this. See, there is no hard and fast rule. Number 1, ideal way, you should know the correct answer and you mark it there, right? Practical way, in case, see, it will depend upon the question, I would say. There is a thing called as elimination method which you can utilize. See, if it is a fact-based question, say they are asking a particular numerical data or when a particular health program was launched in the country, you either know the answer or you don't know the answer and elimination method will not work here. So whatever comes to your mind and there is no negative marking, so whatever comes to your mind, whatever your instinct says, you have to mark and don't change it afterwards. Usually our first instinct is always right in such question.
Yeah.
First thing. Second thing, in case you are getting say a clinical question. In a clinical question, reading the question carefully, applying some logic will always help you in reaching the correct answer. For example, if in case there is a question which is saying, a child is having a rash and they describe the features of rash and they have mentioned multiple options. First of all, look at, is the rash associated with fever? If it is associated with fever, it is likely to be infection. And there will be 2 options which will be non-infectious, that will be ruled out. And then you look at the fever with rash, what are the characteristics, whether it is itchy, non-itchy, what is the progression, any clues like Koplik spot or anything, and that will help you narrowing down and reach the correct answer. So in clinical question, you need to watch out for the keywords, fever present, likely to be infection, look at the gender predilection, male or female, what is the age group, what is the case scenario, something since 3 weeks or more than 3 weeks is not likely to be a acute meningitis or acute infection, but something where there is a progressive loss of weight or progressive loss of appetite, think of a chronic illness, and sudden loss of weight and loss of appetite could be a malignancy. So you need to practice more questions and I think practice gives you the clue. And thirdly, in case there are statement based options, watch out for keywords. Any option which has always present, never present is never the answer if they are asking a true statement, right? What will happen is many times 4 options are given and you don't know the precise answer, but you know that they are asking a true statement and one of the option is absolutely true. Don't overthink, mark it there and then, it is likely to be the correct answer. The short answer to this is practice. The more you practice, the more you will be able to eliminate options. In fact-based questions, it is not always possible, so we need to learn with it.
The second one is how to prepare for NEET PG during internship, how to balance NEET PG preparation along with the internship.
By trying to strike a balance. Don't overdo internship, don't ignore internship. When you are attempting, when you start your internship, you will be having 1 year approximately where in in the limited time that you have, you will be circulated along various departments. There will be certain departments, there will be certain casualty postings, emergency postings, where you will not get time to read. So there it is important that you learn these skills, because end of the day, we did not become a doctor to only solve MCQs, right? There is no such thing as theoretical doctor. We need to learn the basic skills, basics of every branch. We should be watching out for it. So say if you are posted for 8 hours in a unit, at least a few hours should be devoted towards learning the finer points, looking at what is happening, learning the system, and trying to inculcate the clinical aspects in your day-to-day life. Apart from that, whatever branch you are posted in, whatever department you are posted in, trying to solve or read MCQs related to them. I'll give you an example. Suppose you are posted in surgery OPD and somebody asks you to scrub and join you in OT. Now obviously nobody is going to allow you to operate, but it is a appendicectomy which is being done. See there, once you come out of the department, once you come out of the OT, look at the steps of hand hygiene. What were the steps that you took while scrubbing and getting ready? Look at the zones of operation theatre. So surgery part you will be revising. Then appendix or GI is the topic that you are going to revise that day. It is nature's way of ensuring it. And also have a look at what were the sutures which were used. So whatever you have seen, you correlate with it, and next time you go again try to revise it. This will not only be beneficial for your internship life, but it will also help you grasp the concepts in a better way. There will be tough postings and there will be some easy posting. Easy posting, go full throttle. Every day, at least solve 5 to 10 MCQs before you sleep off, right? Even if it is a very hectic posting, still you take a bath, still you take meals. Why not solve 5 MCQs related to the department? Small drops make a big ocean.
Yeah. And there is a common pitfall that prevents a student, like we have seen that maximum student in FMG exam is stuck between 140 to 149 range. So what do you think they are missing in their preparation?
See, there is no clear-cut reason for that. That will vary from person to person. But generally, if somebody is consistently scoring 140 plus, that means your theory, you have read most of the things already and you have a base which is about 140 or so, but you are unable to break into the 150 plus club for the simple reason, either your MCQ practice is not good, number one. Number two, your accuracy is lacking, which can be overcome by revision. For example, I always give this example, cystic fibrosis. You will get a question, CFTR gene of cystic fibrosis is found on which chromosome? But there will be two options, 7p and 7q. Now, long and short term of chromosome, you need not remember in every condition. But in conditions, topics which are frequently asked, you need to be very precise and focus on accuracy. So, increase accuracy during revision on frequently asked subjects or topics for the exam. Your score will start rising. Practice more MCQs. And thirdly, try to see, are you leaving any subject? Are you leaving any particular system in a major subject? Like we have a tendency, I have seen a lot of students, they either read only CVS and CNS in medicine, or they don't read CVS saying I will make it up from the other system. That is not something which is going to work. Every subject, every system is important. You need not read cover to cover, but read the relevant important points and focus on accuracy. Working on accuracy with more fast revisions and solving a bit more MCQs will make you cross easily into the 150 plus club.
And there is a lot of confusion and chaos regarding the new NBME pattern. So what do you think, whether it will be curse or a boon for a student?
Which kind of pattern are we talking about?
We are talking about the 50 questions and the 50
that time-based sessions.
Yeah,
you are saying.
time-based.
Okay. So basically, see, there is we need to understand one thing. The pattern has been introduced, and there is very little you or me can do about it, right? So it is better that we accept it, that yes, the system is there. That is the first thing, acceptance. Second thing, look at it from a positive way. Don't look at it from a negative way, because the system has been introduced for NEET PG, for FMG, for NEET super speciality, and for the DNB entrance, DNB exams as well, and the fellowship exams as well. So this is a system which is going to be there. How do you adapt to it? First of all, try to solve, whenever you're solving the questions, try to do them in a time bound manner, number one. Number two, whenever you're actually sitting in the exam, and if you have to solve say 40 question in 40 minutes, don't think that you have 40 minutes. 35 minutes that you have for 40 questions. So that 5 minutes, something is left out, last minute you want to change, you can do that, and last 2 to 3 minutes, you can take a pause, take a deep breath, gather yourself mentally before the next session starts. The next session will start immediately afterwards, right, in the same paper. So you need to practice that. Thirdly, it is actually a boon in one way that many people are in the habit of overthinking. Yeah. They will first mark the correct answer, and while doing revision, they will come back to it and they will say, okay, this is not looking right, they will change the answer, only to find the first one was correct. So this will reduce the chances of panic change of the answer. This is called a panic marking. Panic marking will actually reduce in this system. Having said that, this is a system which is going to stay. So like a marasmic child adapts to starvation, adapt to this system, and you should be able to do it.
Okay. Thank you, sir, for your time, and I hope that this conversation helped lots of students and solve all the doubt they have. And thank you for joining in. Bye.
Thank you, Diksha. Thank you so much. Bye bye.